Okay, so so as we try to find a comfortable position for the sleeper, I think this is something that most PTs and chiros can appreciate right off the bat. For the trainers and people who don't get a chance to play with joints all the time, this is something that they just need to be considerate of. When you take a joint through its end range, you're going to have different things that check the range of the joint. And so when you have, so in a classic PT chiro setting, you're going to have different what are called end feels, right? And so you're going to have, normally you'd want to feel like a firm end feel, which just tells you that the contractile tissues that you're looking for have wound up. And it should just feel like anything else that you put on stretch, but of course now in a rotational manner in this setting. And the one thing that you definitely don't want is you don't want to hit that abrupt or what we would call like a hard or bony end feel. That will feel like a block. Clinically, we would call it an osseous block. And of course, the other thing we might feel is pain in those instances. So basically, if you feel like the amount of elasticity you're given is slowly winding down, then that's probably something closer to a firm end feel. Whereas if you just run and you hit an abrupt stop, that would be your hard end feel. Okay, and so you're feeling that firm end feel at this point? Cool. And so from the FRS bioflow perspective, we're obviously winding everything from superficial to deep, and the deep being that capsular stuff closest to the bony articulation.
So in terms of my pales contraction, where I'm firing into external rotation in this motion, what would some of the sensations you would try to feel in terms of the contractile tissue?
I would tell my patients in their mind's eye what they should feel is they should feel all that stuff on the back of their shoulder from their shoulder blade. Most people identify with their delts. All those things from the shoulder blade leading into the delt, ramping up, all that backside stuff.
Okay, and then for the rails contraction, what would you expect to feel there?
I would expect them to feel stuff deep in their armpit as they're trying to finish off a ghost in arm wrestling.
I like it. That's good. Yeah, the armpit is tough for a lot of people to feel.
The armpit is tough for a lot of people.
Yeah, to get the regressive tissue to get that, so people really struggle with that. That's good though. I like that arm wrestling. Finishing it off is good. Nice. All right. What about? I guess we should let's do the Americana. Why not?
Okay. So the Americana out of prone. Once again, so your pale stuff that you're going to pales. If I have Ian push into my hand here. That pale stuff, they're gonna feel front side of chest, and once again, from the chest, it will then trickle into that armpit region. But for most people, when they're doing Americanas, they're gonna feel anterior side stuff, just not so deep into the armpit, even though they should. Is that what you feel?
Yep.
Chest, armpit,
Yeah.
a little more bias into the chest. And then, of course, that same stuff you're going to think about.
What about bicep?
People will feel bicep because that's what they're going to use.
Is the bicep an internal rotator?
The bicep is a very slight internal rotator. The short head that attaches to coracoid process does have a internal rotation pull, but the lever isn't very strong for that.
Yeah, and it should definitely not be the main thing you feel.
Right. Coracobrachialis, probably a stronger internal rotator based on lever, but I mean, you're still talking pec, lat, teres major, serratus anterior, your big internal rotators.
Yeah. Okay. And then for my rails?
And then for your rails, you're just going to lift off my hand, try to backhand my face, right? You're going to come in and wind this stuff up, and you're just fighting for millimeters, right?
Mm-hmm. And the tissue that I'm looking to feel?
The same stuff that you felt with the sleeper.
Cool. So deep in the backside.
Deep into the backside.
That runs from the shoulder blade into the
yes.
the capsule.
Yes.
Nice. Yeah, and especially I find that with the sleeper that sometimes people will feel, they'll say like almost my tricep is stretching, but they just don't know how to feel that deep stuff in there.
Right.
Makes sense. Awesome. I think that's really helpful for a lot of people.
Good.
Yeah, they have a lot of trouble with that. I get asked that all the time. And it's almost like you want to be specific, but you also want to keep it almost general in that circumstance, you know, because then people start to try to pinpoint exactly where they feel instead of getting that actual like wind up that you're talking about, which is even more important.
Right. So actually, you know, I think Hunter had a great way of stating it, is that, you know, stretching is its own skill. Like, I'm terrible at stretching, right? I mean, I can get stuff, but I prefer having a coach work with me, just because to be able to drive full pails, rails, and, you know, live somewhere where I don't want to live, that's a hard thing. But for the people, depending on their own personal practice with movement, I'm totally fine with just being very general with them. It's the very skilled movers that I then are going to try to go for more and more specificity. Yeah. I mean, the people who are very, very specific at what they're able to find, it's no surprise that they're very good movers.
Yeah.
Right?
Yeah. Makes a lot of sense. Awesome.